One of the real dilemmas for patients is the issue of surgical options. The typical surgical options are mastectomy versus lumpectomy. Please remember there's no perfect solution. One of the important factors here is that your doctors understand that you are in fact a candidate for breast conservation, or what is known as lumpectomy. Now, each has an advantage and a disadvantage. With lumpectomy, you're able to keep your breast, but you will need some form of radiation therapy. And because the breast is still there, you have a small chance each year that the cancer can reoccur simply because the breast is still present. That small chance is in the neighborhood of around 0.5 to 0.7% per year. And the law is very clear that any changes that go on here can be matched up by symmetrical changes on the other side. So the advantage of the lumpectomy is you get to keep your breast. The disadvantages are that you have a chance of the cancer reoccurring, albeit quite small, and you will need some form of radiation therapy. On the other hand, there's mastectomy. With mastectomy, it is a bigger operation. Generally, you don't need radiation therapy, and you should decide whether you want to have reconstruction or not. And in the world of mastectomy, we now have choices. Typically, we've talked about what's called skin-sparing mastectomy, where the nipple or realar area is removed, but all of the skin, or most all of the skin, is saved. And the reconstruction then is in two stages. The first stage being at the time of the mastectomy with a temporary implant, followed several months later by the placement of a permanent implant. More recently, the option of nipple-sparing mastectomy has come to bear. And this has the advantage, obviously, of keeping the nipple or realar area and getting a much better cosmetic outcome. You should be working with a multidisciplinary team. Please understand there's no perfect solution. Each has its advantages and each has its disadvantages. Ultimately, the decision is yours.